Hi, my name is Vanjie, and yesterday I had thumb basal surgery. Yesterday was September 18, 2015. I had it done in Waters Place in the Bronx by Dr. Roy Kulik, and he was an excellent doctor. The surgery was about an hour and a half. I just want to tell you a little bit about what I went through because when I was researching this surgery, I saw one lady, she had written on she was on the internet, and she talked about her experience, but her experience, she had complications, and it was kind of scary when I looked at it because I was like, oh my God, what am I getting myself into? But thank God my operation went well. I don't have any complications. I'll tell you step by step what happened. Thumb basal surgery is they take a little bone out of here. It's called the trapezium because I had really bad arthritis. And then they take a ligament from your wrist and they boil it up. It's called like the anchovy procedure, and then they put it in its place. So when I got there, it was a mini hospital. It was a ambulatory center, and basically it's exactly like you're going for surgery. They come in, and what hurt the most was when they put the IV on this hand to put all the sedatives and stuff in there, and then they ask you a million questions. The doctor actually even wrote his initials on my arm to make sure that was the arm that was going to be the surgery would be done. And then they asked me a million times what my name was, date of birth, and what was I there for, I guess to make sure that they don't make a mistake, which is good. And then the nurse came in and she told me she was going to put a little sedative because they give you a needle in your arm around here to numb your whole arm. But I never felt anything because after she said, I'm going to give you a little sedation, I just know that they were waking me up after the surgery. After the surgery, I was like very sleepy. The nurse says some people they're wide awake, but me, I'm a big baby, and I was very sleepy afterwards. I had to have them help me get dressed. I suggest if you're gonna have this done, use a button shirt so it's easier to put on afterwards because you have this gigantic dressing. And then when I went home, I had this horrible thirst constantly. Like every 5 minutes, I had to take a sip of water, because my mouth was so dry and my throat was dry. So I called because I was like, why is this happening? And the nurse said that it happens because they put some kind of medicine in you when you're having surgery, because they put something down your throat. And when they pull it out, they don't want like a wad of saliva to go down your lungs and then you get pneumonia. And then she told me it would last about 12 hours, which it actually went away in about 12 hours, but it was kind of annoying. That was one of the most annoying things. The second thing, my arm was totally numb. It was kind of freaky because I would put my arm and it would just drop off, and I had no control of it. I had to lift it with the other arm, and that they said it could last from 24 to 30 hours. But it was like 5, 6 o'clock. I already was feeling my my arm. By 8, 10 o'clock, the numbness was completely gone, which was great. See, I could move my fingers. I could even move my thumb. Yeah, my arm, it hurts a little bit. It wasn't too bad. Last night, I took a pill just because since the numbness went away, I felt that maybe I might get pain in the middle of the night and I wanted to sleep. But it really wasn't bad. And so far, thank God, I'm feeling okay. I did bang my hand just a few minutes ago and it's kind of hurting now, but otherwise it's not bad. I just wanted somebody else to see my video because since I saw that other lady's video and I really felt bad for her, and thank God she's doing good now, but she had complications. She had nerve damage when they put the needle in, and she also had a frozen shoulder, and thank God my arm is moving, it's fine. It's an adjustment working with just one arm, but you can do it. And so I'll try and let you know what happens when they put my cast. Monday I go, Friday I had the surgery, Monday I go just to see, so he could see how I'm feeling, whatever. And then the following Monday, he's going to put a hard cast for about 4 weeks. And then therapy afterwards, but we'll see what happens. I'll try and post again later on just so you know what's happening. And if you're having this surgery, good luck. And I'm hoping you have my experience, not like the lady's experience. You know, I had a great doctor, and Hutchinson Medical Center is wonderful in the Bronx. It's state of the art. It's brand new. And Dr. Roy Kulick, excellent doctor. All right, I'll talk to you guys later. Thank you. Bye.